So the reason it's important for Ochsner to be part of this network is that Ochsner is committed to being a solution for employers. We know that the main pain point for employers is the cost of healthcare has gone up and up and up, and we as a provider feel we have to be responsible for that. Being able to make sure that patients have proactive experiences, that we anticipate their needs and can deliver on those needs is actually easier to do in a high-performing network. And so I think the reality is, here's a value prop that starts with a lower premium price in the market and then continues to deliver by virtue of delivering better health outcomes for people. So to me, it's really the perfect solution to the healthcare cost crisis that employers are facing. One of the best examples of kind of how we deliver value through this product is by including our digital medicine programs in the benefit design of these programs. This is an innovative way to manage some of the more common chronic diseases like blood pressure problems and diabetes. It allows for patients to use wearable devices that connect into the cloud and bring their data into our ecosystem where health coaches and pharmacists can manage those conditions with patients, including titrating their drugs. And this allows patients to actually get better control of their conditions while not leaving work, while not having to come into a doctor's office to see a physician. We think that's the way of the future, and we think it's really important that we offer that through our Blue Connect product. I don't think we look at Blue Connect as having market-specific distinction. I think the value really comes from having a footprint across multiple markets. So Blue Connect, our product, sits on a network that spans from Shreveport to Lafayette to Baton Rouge and New Orleans and the Northshore. That allows more employers who may have employees across the state to participate, and I think that's a real differentiator and a strength of our network product. Finally, we've built a lot of programs for members to have a better experience inside our product. This could come in the form of having access to 24/7 nurse triage services, case management, care coordination services to kind of proactively outreach to patients and make sure they're getting the preventive services and care that they need. And then finally, we've tried to make care more accessible through telemedicine at $0 copay within our product, and through our digital medicine program that allows patients to manage their chronic diseases without having to come into the doctor's office, keeping them at home, keeping them at work. So if you put all that together, we think we've got a real great solution and a great partnership with Blue Cross.
LCMC Health has a rich history in clinical excellence. The high-quality outcomes and personalized care provided to our employer groups really give the ability to leverage a health plan in hiring and retaining your employees. We all know that healthcare coverage is one of the top reasons an individual may choose to work for an employer, and LCMC Health and Blue Cross Signature Blue really provide that for you. LCMC healthcare providers are not only great practitioners, but they really understand that there's a business side to healthcare as well. We deploy strategies across all of our practices to reduce those unnecessary medical costs that can really drive up the cost of care associated with low-value procedures and services that really provide no benefit to our patients. LCMC Health's clinical and quality outcomes are the best across the Gulf South region. Having access to the LCMC Health over 3,000 care providers really provides our Signature Blue members continuity of care across the entire healthcare spectrum. LCMC Health is extremely proud to have received statewide recognition from Blue Cross Blue Shield on 2 care delivery programs by our primary care providers. We've excelled in hypertension and diabetes management, among other peers across the state. We're also very proud to be recognized in the vascular care delivery through one of our vascular care clinics in the New Orleans region. LCMC Health has a clinically integrated network called LCMC Healthcare Partners that really focuses on care management programs to assist our primary care providers in managing those high-risk, high-complex patients. Our primary care physicians enroll our patients in these chronic disease management programs to help manage their complex conditions, to have better pharmacy management, and to keep them out of the hospital when it's not necessary for them to be there. We really work to reduce emergency department visits, to keep them out of the hospital after being discharged to home, and to make sure their care is with the family in the practice. LCMC Health offers free introductory rates to our Wellness Center in Metairie, and that converts to a discounted membership within our Wellness Center. We also offer free chronic care condition management programs to all of our Signature Blue members as part of their normal delivery and care. We also have the LCMC Health Nurse Hotline, which is available to all patients 7 days a week for any questions or concerns they might have. LCMC Health knows and understands the power of brand identity and that Blue Cross Blue Shield is a significant brand in the New Orleans market as it pertains to health insurance coverage. So as we seek to work more closely with employers in the healthcare arena, it makes perfect sense for LCMC Health to be partnered with Blue Cross Blue Shield in the delivery of healthcare.
Precision Blue and FMOL-HS are mutually focused on doing what's best for our patients. So we work together, we review data, we meet often, and we try to figure out what's the best way we can deliver care for those patients. So in the end, what that means is better care for the patient, a big decrease in cost, and ultimately a better experience for the patient as well. It's really about value, right? Value, value, value. We know that employers want to find the best employees. They want to attract the best employees, and of course those employees, they want them to stay healthy because then they don't have problems with absenteeism and presenteeism. So we really focus on making these offerings focused on keeping the patient healthy, and also that happens to keep costs down, which employers also like. And because of our relationship with Precision Blue, we're able to offer a lot of services that we just couldn't otherwise in a traditional healthcare model. So we have specialized care and manager nurses who really get to know the patient. They're able to help them to answer questions about their health conditions. They're able to do education on how to take their medicines in the best way. We also have specialized partners called CCPs, or clinical care partners, that work with physicians to make sure that we close all those gaps in care. Again, making sure that people get the care they need at the time they need it to make sure we keep them healthy. So we're constantly watching our data on costs, we're watching our data on our outcomes like hypertension and diabetes. We measure ourselves on colonoscopy rates and mammography rates because we know if we give the right care to the right patient at the right time, we'll keep them healthy and again, avoid the need for rescue care. So one thing I'm really proud of is that we're able to decrease costs by over $100 million while improving outcomes, which is really what's at the heart of value-based care. It's important for our group to be part of the Precision Blue Network because we're a mission-driven organization, and the best providers in this region have chosen to work with us because they share our values. So that's really important. They want to keep patients well. They want to work with us to make sure that they provide that great care, fits with their values and with our mission.